Hi and welcome to this video. Today we'll explain how we'll perform the induced sputum. It is a test that's performed by your healthcare professionals to understand what kind of inflammation that's in your lungs. This is particularly helpful when dealing with diseases like asthma, chronic rhinosinusitis, or persistent coughing. So we'll start by performing a spirometry or a lung function test. So you'll place the nose clip on your nose, lips around the mouthpiece, breathe calmly a couple of times. When you're ready, a deep breath and power all as hard as you can, hard as you can, and hard as you can, hard as you can, and breathing. Good, perfect. This spirometry will be used as a baseline for assessing how the induced sputum is affecting your airways. So we'll move on to the induced sputum now. So if you come over here. We'll start by doing an inhalation of bronchodilator. So you'll twist that. Right, yeah. This will now work for a couple of minutes, and then we can proceed to this induced sputum test. So the induced sputum test contains of 3 steps. We'll start by putting hypertonic saline 3% in the chamber. We'll then turn the nebulizer on, and the patient will place their lips around the mouthpiece and breathe calmly for a couple of minutes. You might feel a mild urge to cough or a little bit of tightness in your chest, but it's very well tolerated. And the bronchodilator given beforehand should mitigate this as much as possible. So when a couple of minutes are done, you will then be asked to cough in a container. So a deep coughing, and then perfect. The procedure will now be repeated. 4% hypertonic saline. Then you'll cough some sputum, then we'll perform it with 5% hypertonic saline, and you'll cough some sputum to ensure a good enough sample.